Passion unites us. Some of us apply our passions to creating beautiful music. Others apply our passion to making wonderful engineering structures, such as the Live Lab. And others apply their expertise and passion to helping patients. I apply my passions to improving patient care and quality of life. To do so, I'm designing the future of medicine. I specifically study bleeding disorders and those affected by them. Bleeding occurs after injury. So if you have a cat scratches you, you bleed, and then you clot. After bleeding to clotting takes about 15 minutes. Now, not everybody can clot effectively because of bleeding disorders. And these account for 1 in 4 deaths worldwide, and bleeding disorders in general affect 1 in 10,000 people. It is these people I seek to help. To do so, I design therapeutics and diagnostics to proteins that cause disease. I take the protein sequence, I put it into my computer, and I mix it with 10,000 random molecules. I then screen these molecules for specificity and affinity to my target protein. In this way, I designed and developed 23 molecules to a platelet protein that, when mutated, causes a platelet disorder that produces super large clots in patients. And so I screened these 23 molecules and I found one that is super potent. That's what I'm going to be talking about today. So, in our blood, when you're injured, we have a green patients with this disease have a green mutated platelet protein that interacts with a blue blood protein. What I found is that my magenta molecule, the one that's most potent, actually will block the interaction between green and blue as such. And so to show you the actual data, I have this. The top image is a super large clot. This is in the presence of saline. I then add my magenta molecule and it disintegrates the clot, this synthetic clot. And so in our quantification, just the two far right bars, the middle bar is, the super large bar is the actual quantification of the top image, and then the far right bar is the quantification of the lower image with the magenta molecule, meaning that we completely ablate clot formation. This is very exciting because I need to tell you that for this disease I study, there's no effective therapeutic nor diagnostic for this disease. So this is a great indication we might have a therapeutic. Now, I told you that clotting takes about 15 minutes. So the question becomes, does our molecule behave in that time frame? So to test this, what I did is I took the green and blue proteins, put them in a tube, let them sit for 15 minutes. I then divide that into two separate equal volumes, supplemented one with saline and the other with my magenta molecule. And what we found is that my magenta molecule actually strips the green protein off of the blue, meaning this is a therapeutic. And this is the actual data. So in this target picture, you see a black blob on the right. That's a band showing that the two proteins interact in our saline control. Immediately right beside it, to the right, you see nothing. This is showing that the magenta molecule strips off green from blue. This is real-world data, and the quantification shows you that quite aptly. So, I will also say that this molecule is extremely potent in that it binds 15 times stronger to our green protein than COVID binds to our cells. It's extremely potent. So we're going to continue testing this therapeutic on patient platelets. That's happening right now in Italy, New York, and Kingston. Depending on these results, we're going to go into the mouse model, which is a big barrier to FDA approval and adoption. And then with our diagnostic company partners, Precision Biologic, who operates out of Halifax and Hamilton, we are going to develop this molecule as a diagnostic tool, as well as other diagnostic molecules to other bleeding disorders. And with that, I'd like to thank my supervisor in the lab, Ashkan Golshani, and my other collaborators and our funding agencies. Thank you.